Hi, I'm Danny O, and on today's episode number 2, I talk about biometric data, I talk about knee surgery, and I recap what we went over in the last video. There used to be two definites in life, and that was death and taxes. Well, I think there's two new definites in life, and that would be diabetes and surgery. It seems like a lot of people that I see that are in their 50s and 60s and sometimes even 40s are having surgery on joints, including knees and hips and shoulders, etc. Now, obviously, surgery has come a long way in the last 20 years, and the amount of these surgeries that go on are ever increasing. What I'm worried about is the lead up to these surgeries, especially knees. If we talk about knees in general, arthroscopies, excuse me, where the surgeon goes in and clears up a little bit of tissue in the knee. What actually is happening there is you're not addressing the biomechanics of why the actual knee was injured in the first place, or why the knee has pain in the first place. And so if you just get rid of some of the tissue that's catching, what happens is eventually there's just bone on bone and you'll need a knee replacement. So what I'm trying to encourage is people to avoid that initial surgery, that initial arthroscopy, and actually work on your biomechanics, your strength, and try and balance your body. There are many people around who do that kind of thing, but you need to get involved in some sort of exercise and identify what is actually happening to cause you that pain in the knee. Same thing with the hip. I follow a thing called the joint by joint approach, and you can do a Google search on that. It basically means ankle joint is mobile, knee joint is stable, hip joint is mobile, lower back is stable, thoracic spine is mobile, etc., etc., all the way up the body. What we're looking at there, or what I'm looking at there in particular, is a stable knee with mobile hips, mobile ankle joints. So if you work on that principle, if you work further up the body, the lower back has to be stable and the thoracic spine has to have good rotation. For people that have had treatment with me, I always say that the vertebra in the lower back is about 3 to 5 degrees of rotation, so it only rotates a little bit, and the thoracic spine actually has 12 to 13 degrees rotation, so it rotates a lot more. So if your thoracic spine is stiff, your lower back has to do more work. Also, if your hip joint is stiff, not moving as much, then your lower back is going to take up the slack. And that's basically the principle I use when assessing people and treating people, is trying to get the hips more mobile, trying to get the thoracic spine more mobile, to take pressure off your lower back, to take pressure off your knees, and also try and get your ankles mobile to take pressure off your knees. Does that make sense? Hopefully doing something like that earlier on, or even when you have knee pain, can alleviate that pain and you can avoid surgery later on. I think that makes sense, and it works really well for the people I see. I talked about last video about biometric data, in particular the Fitbit. The Fitbit is great for looking at your heart rate, number of steps. A lot of development in terms of biometric data, in particular something like smart pants. So you wear your smart pants and it'll give you updates on your girth measurement. Something will give you a body fat percentage on your smart pants. So you'll go to buy something at McDonald's or a takeaway place, and the smart pants will be linked to your credit card, and it'll do a quick assessment on your girth measurement, and it'll decline your credit card when you go to pay for your burger, because basically it's saying you're too fat. I think that will happen in the next 10 or 20 years. I think we'll have biometric data in our clothing to identify how we are, minute to minute, hour to hour, day to day, and be giving us a lot of feedback. I had a friend, actually I used to train her in the gym for 3 years when she was young. She's a friend, she's now a colleague, she's almost finished her study at university. She's doing a lot of research on compression garments, and I have no doubt these compression garments will have biometric data in them in the future. So I just want to say hi Essex, I hope things are going well, and keep me informed in what's going on with the compression garment situation, because I think the biofeedback technology is really heading in a good direction for the good in the future. But I hope you got some information, and I'll talk to you soon.